And welcome to Mom Matters, created by moms for moms, a safe space for moms' voices to be heard and for us to lean in and support each other and talk about difficult conversations. Now, you may have seen my previous conversation with Dr. Perello on Idaho Today on the topic of pelvic floor health. Today, we're actually going to get a little more into the weeds, if you will, on this topic because it's a very important one. So again, I welcome you, Dr. Perello. Let's talk about pelvic floor health. We're going to set the stage again to catch everybody up who may have not heard the first conversation. Then I really want to dive into some of the main points of this topic. So, okay, the pelvic floor, we've heard about it a lot, but I don't think a lot of women really realize the full function of the pelvic floor, what it does for our health, and why it's important that we pay attention to it. So, again, what is the pelvic floor?
So the pelvic floor is a group of muscles and ligaments that sit at the base of your pelvic bones and sort of serve as a support hammock for your bladder, your vagina, your uterus, and your rectum.
Okay, all right. It already sounds incredibly important.
It is very important.
Okay, so it's something we really want to pay attention to and keep healthy. In what type of situation would a woman find that she might be having issues with her pelvic floor?
Sure. So women can develop incontinence, leakage, or prolapse where things are falling down. They also might have pain in their pelvis and their bladders and their abdomen and their back, and all of those things can be related to the pelvic floor.
Okay, so pain in your back might actually be a pelvic floor issue.
Yes.
Okay, because I know previously you and I talked that the pelvic floor actually attaches to other muscle parts, right?
They do.
Parts in your back and your legs. So could you even have like leg issue and have it be like your pelvic floor?
So sometimes, yeah. Okay. Maybe more groin issues would be more related to the pelvic floor.
Got it.
It's more typically back and abdominal pain.
Okay, all right. What are the most common situations in which you see a woman developing an issue with her pelvic floor?
So a lot of women will develop issues after childbirth. They can develop issues as they age, as we go through menopause. But then there are just sort of lifestyle things. You exercise in a funny way and you pull something and don't realize it. You lift something heavy, chronic constipation. All of these sorts of things can lead to pelvic floor issues.
Okay, so it sounds like anything that really strains that muscle group.
Right, and they're not muscle groups that we have a good sense of. Like you pull your hamstring, you know you pulled your hamstring.
Yeah.
You mess up something in your pelvic floor, you might not know it. You can't feel it in the same way.
Okay, it just might be causing other issues that you're attributing to something else.
Correct.
Okay, let's talk about moms giving birth and having pelvic floor issues.
Yeah.
Is this something that they notice right away, or is this later down the road? Like, how soon do you go, ooh, something's a little off? Because let's face it, women, when we have a baby, it takes a while for us to feel like we're back in our bodies.
Yeah.
Right? And that we can recognize our bodies.
Yeah, so you can have issues immediately.
Okay.
You know, we want people to take some time to recover and let things heal. And a lot of times those initial issues will get better with time. A lot of women go to pelvic floor physical therapy after they have babies, and initial leakage will go away or prolapse will go away as they heal. But over time, those issues can come back, and for some women, they don't improve after they have a baby, and they sort of become chronic issues at that point.
Okay. And what about women in menopause?
Yeah.
Or is this something that they can experience as early as like pre-menopause, or is it typically during menopause or post, or at any point?
At any point, frankly. Incontinence, there are several different types, but there are some forms of incontinence that even children can experience. Incontinence does worsen with age, and for women particularly, but kind of runs the gamut, all ages and all types.
Okay, so you'd mentioned that there's types of incontinence.
Yeah.
What are those?
Yeah, and so the two main ones are called either stress or urge incontinence. Stress incontinence is when we increase pressure in our bellies, so coughing, lifting, exercise, bending, those sorts of things. Urge incontinence is more when the bladder is squeezing on its own without you giving it permission to do so. So rushing to the bathroom and you'll have some leakage, or even just having leakage sitting here doing nothing. And they're treated in totally different ways, so it's important for a provider to tease out which one you have and then help you figure out how to go forward with each.
Okay, so it sounds like there's a way to treat this though, right?
There are.
Okay.
There are.
Which is why it's important we talk about these things.
Very much so.
Okay, so let's help people understand the perspective of how common these issues are, because I think in many women's circles, unless you got a really close group of friends talking about urinary incontinence, talk about prolapse, those are topics that are very personal.
They are.
And it's not, they're not topics that you usually share when you're at brunch, you having mimosas, right?
No.
So how common is urinary incontinence in women?
So about 45% of all women will experience urinary incontinence, and similar numbers for prolapse as
Wow.
well. And you're right, unfortunately, maybe only about a third of women who experience these issues actually come and talk to a provider about them. So we can do more.
We can do more.
We can do more.
Okay.
Yeah.
When I want to talk about what you can do to help improve that, and then I also want to talk about prevention. But first, I want to dive a little bit more into prolapse itself. How does a woman? I mean, it's obvious, I think, when you have urinary incontinence, right?
You know.
But let's talk about prolapse.
Yeah.
What does that look and feel like?
So a lot of women describe it as a heaviness in the pelvis, just like it feels like something is pulling down within them. If you actually look with a hand mirror, you might see something within the vagina that sort of looks like a small ball. Sometimes women will have bladder pain with prolapse or back pain with prolapse, difficulty urinating, recurrent urinary tract infections. So there's a variety of signs and symptoms.
Okay. All right. Any of those symptoms, probably a good reason to at least share with your care provider, right?
I think so, yeah.
Yeah. And if anything, if you're not certain, maybe it is just a UTI, right?
Yeah.
Or maybe, there's something else going on. At least you can track those symptoms with your GP, right?
Yes.
Okay. Let's talk about what you can do if a woman has urinary incontinence. What are some of the treatments available for that?
Sure. So there are some behavioral and dietary things that we can do. Certain foods irritate your bladder, maybe make it more likely.
Really?
Uh-huh.
Oh, I've never heard that.
Yeah.
Oh my
Unfortunately,
goodness.
it's all the good things.
So
in
just
the
like,
world.
because you hear all the time your GI, right?
Yeah.
Like everyone knows there's certain foods you have to
Yeah.
navigate around if you have a sensitive GI, but the same thing with your bladder.
100%.
I imagine this is the same for men though too, right?
Yes, it is.
Okay.
Yeah.
All right.
Both sexes. So,
Yes.
Yeah.
So diet restrictions
Diet
potentially.
restrictions,
What else?
good fluid intake, managing bowel function, and then things like pelvic floor physical therapy can be very helpful. There are medications that we can put people on that can help, and then there are surgical procedures that we can perform that can help.
Okay, you said good fluid intake.
Yes.
I think it would probably be common for somebody who suffers from incontinence to want to avoid
Sure.
drinking too much fluid. Let's talk about that.
Bladders like being well hydrated, so there's a balance to it, and it can be really hard if sometimes we need to do other treatments as well to sort of augment that, like requests for patients to drink more water. But bladders generally behave better when people are drinking more water.
All right, the organ wants to do its job.
Yeah.
You don't want to put it out of work.
No.
Okay.
And water's better than, like coffee or juice or any of the other
Yeah,
things.
anything that's high acidic probably too might irritate the bladder. Now that we're
Exactly.
talking about that, that makes sense now. Okay. So that's urinary incontinence.
Yes.
What about prolapse? What can be done to help with prolapse?
So pelvic floor physical therapy can also be helpful in preventing prolapse from worsening. You strengthen those muscles, you have better support. There are devices that can be fitted that help hold things up, and then there are surgical procedures that can help with prolapse.
Okay. If a woman prolapses and then she has treated the situation, is it possible she can re-prolapse again?
Unfortunately, yes.
Okay.
Yeah.
So, and you had mentioned potentially the hereditary aspect to the incontinence, to the prolapse. How common is that?
So we know that there is a genetic component to prolapse at least.
Okay.
I don't think we have a great idea of how often that happens, but you see it, someone will come in and they'll have prolapse and they'll say, oh, my mom had this, both my sisters have this. And
Got
so
it.
there is some familial inheritance to it.
So if a woman knows that her mother or her grandmother suffered from this, she's going to probably want to pay a little extra attention to her pelvic floor and make sure she's taking care of it properly.
Yeah.
Okay. And menopause. So, we talked a bit about labor, how that could lead to prolapse incontinence. Why do we see this in menopause? Even if a woman had great pelvic floor health all the way through her childbirthing years, why all of a sudden would something like this start to occur?
So estrogen is a component to it. We know that not having estrogen can make incontinence worse, probably increases elasticity, and so it makes women more likely to prolapse. And sometimes by repleting it, well, maybe it wouldn't make the prolapse go away. It can definitely help with incontinence and can just make women way more comfortable.
Yeah. Okay, and How do you prevent any of this? Is any of this preventable?
Sure. No, maintaining a healthy body weight is very helpful.
Okay.
Avoiding constipation is very helpful. I think everybody can benefit from pelvic floor physical therapy, frankly. Knowing how to do Kegels, you can do them on your couch. And so I think getting women to see professionals who can teach them how to do that appropriately is really helpful.
Okay, so you said do that appropriately.
Yeah.
Explain, why is it important that we go to a professional for that?
Yeah. Traditionally, people call pelvic floor physical therapy Kegel exercises. That's what I think most people know those exercises as. And a lot of women don't do them correctly. I think that we read how to do them on the internet and we think we're doing them right. But in my office, when I actually have women try to demonstrate a Kegel, a lot of times it's not the appropriate way. And so actually seeing someone who can evaluate you, do an exam, teach you how to do the exercises in the right way, that's very helpful.
Okay, so I'm gonna go out on a limb here.
Sure.
But that's why I'm talking to you.
Okay.
So when it comes to these exercises though, I'd imagine it's a lot like when someone's working out in a gym. You wanna make sure that you're doing the exercise properly, because if you don't, you might be strengthening the wrong thing, and you could also lead to further injury if you're not doing it right. Does that also apply here?
It does.
Okay.
Some people don't relax when they're supposed to, or don't squeeze when they're supposed to, and they're too tight in some situations and too lax in other situations, and it's a complicated muscle system, and that's why having a professional help you with it is really key.
Well, yes, and I mean, a complicated muscle system, I think that's a perfect way to explain it, right? I mean, it holds the baby where the baby needs to be, and I mean, that is not a small, feat.
Yeah.
That's a massive feat, yes. So having some respect, and I think, an understanding for that area too, and celebrating it, right?
Yes.
Understanding what it's been through and what it's done for you, probably so incredibly important.
It is. I mean, I'm super passionate about this. Like women do these amazing things and they suffer silently afterwards, and they don't have to. There are things that we can do to help.
Okay. Again, let's help people understand why it's important that they don't shy away from talking about this.
Yeah.
And that, partners are supporting moms when it comes to this, realizing it's normal, it's okay, it can be corrected, and then it's just it can be a part of the female process.
Right. It's a quality of life issue, being able to go to the bathroom when you want to, feeling comfortable as you walk around, exercising, lifting your kids up. Mm-hmm. These are things that affect women's lives every moment of every day. And women shouldn't have to live having less quality of life than somebody else because they're leaking or because they're uncomfortable because they have prolapse. And so I think getting in to see somebody, getting help with these issues, why not? It hopefully will make you better and happier.
Yes, well, in your childbearing years, the menopause years, you have a whole life still ahead of you.
It's true.
Yeah, so make the most of it.
100%.
Address the issue, own it, make it normal because it is.
It is.
It's okay. Almost half of women is what you stated, right?
Yes.
Are going to experience something in this either category.
It's so common.
Yeah,
and
so incredibly
women don't talk about it and they feel alone, and they're not.
Yeah. Oh, I'm so glad you said that.
Yeah.
Because they are not.
They are
alone.
not.
Okay, before we wrap though, I do want to talk about the menopause aspect. You said hormones lessening, and we hear this time and time again, that the lack of estrogen can really deplete muscle strength and tonality, which I imagine impacts that area as well too. What about hormone replacement therapy? What role do you think that plays in a woman's process through menopause and beyond?
I think it's hugely valuable. We can replace hormones both vaginally and then systemically. Vaginal estrogen is really helpful for making women more comfortable, making intercourse more comfortable, preventing urinary tract infections. It can help with some forms of incontinence. And then systemic estrogen, there are so many things that it probably helps with in the peri and postmenopausal space. Mood swings, hot flashes, body weight,
bone density,
muscle development,
cardio health.
There's so many things that it can really make a difference with. And for the most part, for most women, it's a very safe thing. And so I think women coming in, having those conversations with their physicians or finding a provider in the Valley that is open to hormone replacement is a valuable resource.
That's such great advice. I can only imagine as you were listing that, the potential other symptoms that women are going through during that chapter of life, that they're dealing maybe with perhaps some urinary incontinence or just feeling a little off down there, they go in to visit their doctor, they get hormone replacement therapy. Not only does it help with that, but it helps with the other things too, right? It's like all of a sudden a whole new woman.
It's a super rewarding aspect of a medical practice. You know, like women coming in and saying like, I feel like myself again. And that's, you love to hear it.
Absolutely, because like we stated, there's a whole other life beyond these chapters.
There is.
Yes, there's no reason to sit and to suffer
No.
and feel like this is the end road, I'm just accepting it, this is a new way of life. Blah.
Exactly.
No, there's
don't
no
do it.
blah. Okay, so give a little piece of advice here. What should women do then if they are feeling that they're having an issue, either with incontinence, with prolapse, or they're fearful that something might be developing?
Yeah, so they can see their general provider, ask for an exam, ask for a referral to a specialist, and we're here and happy to help.
Wonderful. Dr. Perillo, thank you so much.
You're very welcome. Thank you for your
Greatly
time.
appreciate your advice.